Welcome and thank you so much for joining us for this morning's workshop on survivor strategies for coping with fatigue, memory, and anxiety and depression. My name is Rory Lee, and I suffered a brain injury 5 years ago falling on my own driveway on the ice. I'll be co-facilitating the workshop with Mark Hebert, who's going to introduce himself.
Good morning, everybody. So glad to see all of you this morning. My name is Mark Hebert. I suffered a traumatic brain injury. Just had my 7th anniversary here in April from a car accident from a distracted driver.
And our panelists here, our expert panelists.
Distinguished, yes. I'd like to introduce Mary Ann Tubbs, part of Voices, and Herb Williams, also part of Voices, and Tom Gilbert, who I met this morning. And Tom, thanks for pitch hitting for us today.
These are all here. Our other brain injury survivors and members of our support group, and 2 of them are members of Voices.
We're having trouble hearing.
Okay, I'll raise my voice. How's that? So we have Mary Ann Tubbs, Herb Williams, and Tom Gilbert. Okay? The final member of the team is Ross Goldberg, who's running around here somewhere taking videos and recording things. He's my husband, my support person, and my caregiver. And he's also supposed to come in and keep track of the time, so hopefully he'll keep us on track when he gets back, because we do tend to kind of wander a little now and then. And we do want to make sure we cover all of the things we want to cover today. We've planned for this workshop to be interactive. That means that we don't do all the work. You get to do some too. We encourage each of you to participate so we can all learn from each other and with each other. We have a series of questions about coping strategies for dealing with these 3 issues that face many brain injury survivors. And first we're going to have our expert panelists answer the questions with some coping strategies of their own, and then we're going to expect you to kind of participate and chime in and add other strategies. I'm going to try to keep up with you and record them on the flip chart. We all have issues with distraction, so we will be giving you the handout of some strategies that we came up with on our own afterwards, so that you're not kind of reading that and moving around. Being distracted. And to make you think and take part, and not just look at the list and say, oh, I like that one. But actually tell us what strategies you found it helpful. And as you know, brain injury can cause a variety of symptoms. Physical, cognitive, psychological, and emotional problems, and they require compensation strategies to manage. Today we're going to focus specifically on these 3 issues: fatigue, memory issues, and anxiety and depression, because they're very common issues that people face. And I'm going to start writing, so Mark's going to take over the direction here.
So the first part we're going to discuss is fatigue. Fatigue is the most...
Just broke something.
That's what happens with brain injured people. Fatigue is the most common issue facing survivors. Research has shown that fatigue accounts for over 60% of self-reported disability. And at a recent brain injury support group meeting, 100% of the survivors attending reported problems with fatigue. And those of us with brain injury know that the type of fatigue that brain injury brings on is much different than physical fatigue that you have from doing a normal day's work. It's all-encompassing, brain fog, all these different things can affect us. So, our expert panelists, we're going to start with the first question. What strategies do you use for dealing with fatigue? And we're going to start with Mary Ann.
Hello. I deal with fatigue many ways. The first way is if I need a nap, I don't feel guilty about taking a nap. I take naps, one probably in late morning, and 2 Dr. Phil is my nap time. I find it real easy to, yeah. Number one, or another one that haunts me. I'm aphasic. I should preface this. I'm aphasic, so if I have trouble finding the words, or I have trouble getting the words out, it's not the fault of you guys. It's how I am. I have trouble with fatigue if I'm not planning stuff. I write down everything that I'm going to do today. I check it before I go to bed at night, and like I said, I make a plan. If I don't, I'm scattered. I'm scattered. My mind shuts down. My mind shuts down. I have trouble, finding the words, but I have trouble, excuse me. I have trouble formulating thoughts. It's like now is my nap time. So I'm stuttering and stammering.
Are you now?
Yeah, I'm napping. I'm stuttering and stammering because my body tells me it's time for nap.
Thank you very much, Mary Ann. And we're going to move on next to Herb. You might have seen Herb on some golf course in Maine. He's our resident pro golfer.
Yes, I wish. I'm
Herbal.
definitely a resident golfer, because I'm out there almost every day. And even when I'm tired, oftentimes I am just fatigued, but I was injured 12 years ago. My leg was very injured, but I also had a concussion. And for a number of years, I only slept 2 or 3 hours a day. And it hasn't gotten a lot better, but every now and then I'll sleep 4 hours in a row, and I'll go, wow, that was wonderful. That just really felt so good. And so the fatigue, there's the fatigue of not sleeping, but also the fatigue of your brain healing, because your brain takes a lot of energy anyway from your body. And if it's also doing normal stuff, usual stuff, but also healing, then it makes you more tired, makes the fatigue worse.
And I'm Tom Gilbert, and just so you know, in August '99, I suffered a massive stroke. Prior to my stroke, I was a family doctor at BMC, at Boston Medical Center in Boston. In recent years, I've volunteered on the stroke floor at BMC and its Balding Rehabilitation Hospital, and have done research on stroke survivors. And then I came up here to obviously with my wife last November. So I'm a very new stroke from your guys' point of view, but old and magnificently useful stroke from mine. When I was discharged from the rehab hospital, I was very groggy. Partially because I had a seizure medication, but also because I just had, I was groggy for other reasons. Over the last 13 and a half years, my fatigue is better, but it's still an issue, as it is for everybody here. Since the stroke, I have experienced fatigue later in the day, obviously, and again, because that's the norm. Here's some strategies that work for me. And then this is a bunch of easy, simple things. When we're driving, and I do drive, I do the first 2 hours, and then my wife will take over for 2 hours after that while I nap. Great system. If we have an evening activity, I'll take an afternoon nap, same thing. I don't do any appointments before 10 in the morning, so that I don't have to get up too early and feel rushed getting going. And normally I go to bed around 9 p.m. and get up around 7. Same thing, always more than before the stroke.
Thank you, Tom. Appreciate that. We're going to move on to issue number 2.
Well, let's ask. first
Oh, yeah, I'm
right
sorry.
here from
See? Memory problems.
Yes.
Hi, I'm Ken Shapiro. I had a stroke about 2.5 years ago following brain surgery for an aneurysm, which fortunately had not burst until my surgery. So in many ways, I consider myself very lucky. Absolutely what everybody has said resonates with me on the topic of fatigue. I mean, I think there's been an accepted part of exhaustion as part of sort of the natural healing process, and that's accepted by me and by my family and loved ones. I think there's also this self-imposed pressure we put on ourselves to constantly progress and improve, and that contributes to our fatigue as well. Not to say that we should stop trying, that's certainly not my goal, and not to add to anybody else's paranoias about what's going on in their head. One of the things that happened with me is also that my wife noticed that I would stop breathing or gasp for air periodically during the night. That led me to go for a sleep study, which did diagnose a mild sleep apnea. And now I fortunately have been prescribed a CPAP machine, which helps me sleep much better and has improved my energy level. So, as everybody's said, I mean, the benefits of a good night's sleep are considerable. I think in some ways in accepting the fatigue I was feeling before as an expected part of my recovery, I was somewhat reluctant to even accept yet a new diagnosis of a problem, and then have also held up a lot of hope for my new therapy to improve my sleep and hopefully improve my energy levels to the point that I can actually start exercising more and improve my physical recovery that much more. Bottom line is, I don't recommend anybody going through what we've gone through. Just exhausting.
Avoid brain injury to begin with. Okay, Mindy, I think you have a comment.
Yes, I do have a comment.
Fatigue.
Okay, my comment is, I know personally, I learn new things about my body every single day, and, nope, I don't. And, just paying attention to my body and how it responds to things that, I do throughout the day, you know, whether it's therapy or whether it's doctor's appointments or whether it's hanging out with friends, and then, you know, kind of evaluating how my body responded to that, and then being proactive in the future. Okay, I didn't do so hot with therapy, so I know now that I have to rest for 45 minutes to an hour before I go to a therapy session. You know, that all helps with the fatigue, so that I'm not so tired at the end of my therapy session, or I want to go hang out with my friends. I know that in order to be functioning in order to have a conversation with them and be able to actually, you know, interact, I have to lay down and I have to have quiet and I have to have dark and I have to have, you know, my mind and my brain has to have complete rest so that I can go out and do that activity. But that's really all from just evaluating and breaking down how my body responds to daily activity and life, really, that you can't stop living. You've gotta keep going. You just gotta deal with what gets thrown at you and just figure out how to, really. And fatigue is a big part because you can't, everything you do when you have a brain injury, it's just, the fatigue is just intensified and it sucks, but you just gotta, it is what it is, and you just gotta deal with it by being proactive. That's what I
learning from your
learned.
experience.
Yeah.
Ralph, Steve.
Just a couple ideas. The first is that when you first come out of a stroke or some other kind of brain injury, your brain's not working very well. So if you're required to talk to a credit card company or the phone company or something like that, you feel like you're fried, and you know you have to get some kind of relief from that. That's the first thing. The second thing is, personally, I find there's a cyclical part of this fatigue, and one of you mentioned that. And for me, it's right after lunch. You know, I have something in my tummy to take care of, and I'm just gonzo. Especially if I've been busy in the morning. A lot of thought process coming around. It's okay to have a certain cycle of when you have a nap. And the other thing I mean, and probably a lot of you can relate to this, if you don't take your nap, you're not the most pleasant person to be around.
I'm stunned.
Ornery. That's the other thing to keep in mind. It's okay to be fatigued. And, go ahead. I just want to say that one of the great weaknesses I have is I own a Lazy Boy recliner. So it doesn't take long for me to go ZZZ.
The hardest part, I've had my dream for about a year, from February, day after Valentine's Day, 2012.
Speak up a little.
Yeah, I'm sorry, I'm not, it's a lot of person, I'll try to think louder. I got a brain injury, someone coming down the street, swerving all over the place, dry conditions, and slammed into me with a big truck, so they had like a 40-mile-an-hour impact. But the hardest thing I've had to deal with, maybe it's kind of related to fatigue, is that it's hard to get the validation because so many people that you meet, you always think you look normal. And what's wrong with him? There's nothing wrong with him, you just hit his head. I don't see any problem. And to get other people that are not aware of your disability because it can't really be seen causes me great distress and fatigue. And then you feel lazy if you just take a nap because they just think, what a lazy SOB, what's he doing just sleeping? You should be getting up, do something.
I wish I could take a nap in the
Yeah.
daytime, you know?
So-
We've heard,
It's hard, so that's the hard thing.
It's trying to find validation. So what do you
Yes.
suggest?
Especially for the older people.
And that's a very difficult thing to deal with brain injury, is that your arm isn't in a cast, or you haven't got a cut on your head, it's internal. And everyone, like, as you brought out, you appear to be fine to them. But the inner struggle that you're going through is powerful. But there's also a great teaching moment in that for you. It will validate you as a person, and it might help those other people to understand what brain injury is.
Right, I've tried, yeah.
Yeah, keep trying.
Still a work in progress.
Yeah, we're all a work in progress.
And don't forget that we have brain injury support groups here, and that's been a very important part of at least my recovery, is coming to the support groups and finding out I was not alone, and getting a lot of my coping strategies from other survivors. I think we have time for one more.
Yes.
I just got just one other thing. The problem I have, my wife and I are from Old Town, which is just above Bangor, so it's really, we're not aware of any support groups that they have in the area.
You may have to start one.
Yes.
Yeah, well, if I get better.
Can you repeat what he said for those who were?
Yes, he said that they're from Old Town and that there isn't a support group up there, so I said they may have to start one. Because that's,
There is
unfortunately,
there
it
is
is
a,
a problem.
in the Bangor Hospital, they have quite an area for stroke victims and stuff. So probably work with them,
Uh-huh.
maybe you can get someone there to help you facilitate it.
Yeah, EMMC.
Yeah.
They do have, I'm going to Maine Center for Injuries Rehab in Brewer, Maine, and maybe they can
Yeah,
set something
yeah.
up.
Yep.
Well, I don't know what happened to my timekeeper, but I think
Yeah.
we need to move on, so let's hold the other fatigue stuff, and if we have time at the end, we can add to the list. Memory problems. I know none of us here have these issues. But they're often, for a lot of other people with brain injuries, they're really a frequent problem. We may struggle with either encoding, like making new memories, you just can't remember anything new. Or we may have trouble retrieving them, similar to the aphasia Marianne described, where you have the word and you can't retrieve it. You know that you know this person's name, but you can't remember it, you can't find it. So, what memory issues do you have, Herb? And what strategies have you used to compensate?
You know, I've been actually pretty fortunate. That wasn't really one of my characteristics that of my memory, other than the fact that when I would try to concentrate on stuff, it would give me headaches. So, so then I either had to think, well, actually, for a while, I taught myself to not think, just because I didn't want to get these headaches. So I just taught myself, what's that?
Speak,
They're having trouble hearing.
yeah.
You're
thank
still,
you.
okay.
You, get your hands away from your face.
I'm talking. I have to cover my head.
Okay.
So I taught myself to not think, so that I wouldn't get these headaches. And that was the primary thing with my issues. And I had a headache for 2.5 years when I started, and I didn't know I had a headache. I mean, I came out of surgery and stuff from that situation, and it was 2.5 years later, and I said, no, what's different about today? Oh, I don't have a headache. So as we come out of these situations, sometimes things are very common, are happening right then, but they're not necessarily normal or good things to carry forward.
What about you, Tom?
From my point of view, actually, my wife Peggy has observed that since the stroke, I don't remember things as much as I should.
You're gonna have to speak a
She
little
had-
louder because we've got some competition back here.
Yeah. She's, like I say, Peggy's better than I at remembering that I need to write them down if I'm having a stroke. I record all of my appointments on the calendar on my computer, so I'm always up with all that, and if I don't, it's lost. This is easier since the more I've gotten away from the stroke. I was really tough at the beginning, and it's gotten easier in time. And then I update phone numbers and addresses on my computer and iPhone regularly. So those are a couple of things.
Marianne?
What were we talking about?
Strategies for memory problems?
Oh, I can't remember.
It's a real problem.
I have trouble with my memory. I can remember things that from my the time I was little, but I can't tell you what I had for breakfast this morning. The strategies that I have are typing in what I've got to do on my smartphone and then having it ring an hour before I have to do it. My daughter and sons say that I repeat myself, but I can't help it. I don't know that I've said it over and over and over. To make things short.
Any more strategies out here? Yes, we have, Christine, we haven't heard from you.
Like Mary Ann, I can remember people's middle names, birthdays that I've met once, but I couldn't tell you, without looking, what clothes I put on in the morning. So it's very variable as far as that goes. And I don't know how many of you, but I'm a coffee addict. I have to have my coffee in the morning before even one of the veils of fogginess disappears. And I have a habit of wandering around the house to see what I need to do for the day. And then, of course, something distracts me. I set my coffee cup down, and I continue to wander around. Well, I have figured out that I have 36 coffee cups.
Nice.
And each one is in a different place all around the house. As I couldn't find it, I'd go back, I'd say, what the hell, I'd get another coffee cup and I'd fill it up, and then I'd continue to wander around the house. Well, what I did for the strategy for that was, I chose 3 places where I could leave my coffee cup, and that was it. And if it wasn't in those 3 places, then I would get a new coffee cup. But I wouldn't just give in to that, not being able to find it right away.
How could you remember where you,
Well,
where your 3 places were though? That's the thing though, I mean, I can
It
say
takes
I
a little-
can do that and
It takes a little practice, but, it's like, before the brain injury, there were at least 3 places where I would generally leave my coffee cup. It was either next to the coffee pot, next to the chair I sat in the living room, or on my way to the bathroom, because coffee makes you pee. Someplace like that, so I would pick one of the 3 places and I would that's where I would put my coffee cup. And if I felt the need to, and of course then you have to remember that you're gonna be setting your coffee, you have to be aware of what you're doing all the time. Because you can't do anything automatically anymore, because it doesn't register in your memory. And therefore you forget it. So, picking those 3 spots and remembering, I am setting my coffee cup down here.
And I think you're right, actually saying to yourself, I'm putting my coffee cup on the television, or whatever it is.
Or keys or whatever.
Or keys. And another thing, write it down. If you have to, you have a list that says, this is where I'm supposed to leave my coffee cup, until it becomes a routine. Go back to the other strategies. Bethany?
I kind of a combination of the memory and fatigue, especially, well, kind of a long story about my injury. I had brain surgery September 15th, but I was actually in a car accident May of 20th of 2011. And had I not been in the car accident, they wouldn't have even known I had a brain tumor. And I actually was supposed to be having methadone in August. And had I not found the brain tumor, the doctor said I would not have made it off alive. So things happen for a reason. But my major, aside from pain, is short-term memory. And one thing that I had to, and my mom actually had to do it for me, literally make signs of things, just like you were saying, and literally, like getting the gold star for the day when you were younger, because you brushed your teeth, you combed your hair, you put the dishes away. It literally was like starting all over again. And I think how somebody had asked, well, how do you remember those 3 places? Once you get doing it again and again, or even putting coffee cup here, I mean, it might sound so ridiculous, just these little mundane things that used to be mundane to us that we can't remember. I mean, like I would have, be artistic, make these really pretty signs of, where your keys go, just, I had to do that, but it definitely is, finally things are a little bit easier. There's still things I have signs for.
Yes.
So for the signs,
What I've used are neon colored sticky notes, so then, like, if you put your keys, you put a neon green little sticky note and keep it there for at least 2 weeks, and always put your keys on top of the sticky note, and after 2 weeks, you take it off, it's like, all right, that's designated that spot, and you'll remember it more like something brilliant in your mind, I guess, and you can do different colors for different things that, like, instead of just your keys, where you always put your cell phone, or you always put, but not more than 2 things at a time with the signs, it's gonna be overwhelming.
I've learned to, I used to always try to say it to myself, but I've also realized to say it out loud. If you say things out loud, it tends to stick a little better.
Hmm.
You feel silly when you say, I'm putting my keys right here. And no one is.
I find that I have a list, but I expect everybody to know my list, and I get ornery like this. I've been evaluating myself, and I've learned so many strategies, just from.
Just give me one.
And so the point being that I get mad at somebody else if they break my routine.
I don't know if I want to put up here, get mad at other people. Do
Yeah.
you want that to be a strategy?
It was,
We have developed routines and stick to them, how about that?
what's
Yeah.
that?
Or change
Develop a
that.
routine and stick to it.
Hmm.
To them. So, would you say to make that more positive, you need to tell other people about your routines?
I do, but they don't, I have trouble.
Maybe they have a memory issue.
A little bit.
Is there somebody else over here? I think,
This gal right here,
okay, who, Mark, who?
this gal right here.
Yes, I went from beginning with Post-its for things, the most basic things.
So you went from, can you speak up?
From Post-its.
Okay.
At the beginning, and the mind that just wandered a mile a minute. Anyway, I'm 15 months later now, so I'm still pretty early.
Hmm.
But I found that out of necessity, for a different reason, decluttering has
Ah,
been,
Yes.
yeah.
physically decluttering my house actually to a point that previously wouldn't really meet my taste.
Yeah.
It's true. It just helps me to focus more, which ties in to memory, because as I understand my own neuropsych, my primary issue is not so, is secondary, is memory secondary to attention.
Ah, yeah.
So, and I'm, I still don't fully understand, and I go back and forth and I try to figure it out.
I've had that same issue. Mark, you want to take one more, or you want to move on to the next?
This gal in the green we haven't heard from.
So when I first had a lot of trouble, I would forget either shampoo or cream rinse, so I started to develop numbers in my head.
Ah.
So I thought before I got into the shower, I was gonna do 3 things. And I also do it, yeah. I also do it at night when I need to put my glaucoma medicine and my Wellbutrin, and I can't even remember the third thing.
But you know there were 3.
Yeah.
I do that too, I count, I know there's 5 things in the morning, I
Yeah.
take 5 things. If there's not 5, I have to figure out which one I missed.
Yeah.
I just have one, I think I've got.
One, okay?
Acronym is a very good way
Ah.
of doing things. For me to go outside, I've come up with an acronym called SICKWG, which is SCKWG.
Can you speak up?
Yeah, we can't hear you, sir.
Yeah, like, I can't remember what the first one is now, sorry about that. The second one is like cell phone, keys, wallet, and glasses.
Okay.
Is the first one.
So what he's saying is he has an acronym for what he needs to do to go outside, and the letters mean like the cell phone, the keys, the wallet, the stuff. I wish my husband would have one of those. Because I'm always asking, do you have your keys, do you have your wallet? Okay, Mark, you wanna, we'll move on, we'll come back to more of these if we have time at the end.
Great. So we're into issue number 3, which I think is probably the most personal, is anxiety and depression. Suffering a brain injury is definitely a life-challenging and life-changing event. It has psychological and emotional effects as well as physical and cognitive difficulties. Anxiety is a frequent issue among survivors, and having anxiety, it may also lead into depression as well. So we're going to ask our panelists, if you have suffered from anxiety or depression, what strategies have you found helpful? And we're going to start with Tom.
And I've had with another colleague who's also a family physician of me, we've done a study of 12 strokes in their caregiver. And 11 of them in the first 18 months had depression of some sort. Unlike the doctors in the hospital, which is a rehab hospital in Boston, that think that it's about half. So just so you know, there's a lot more depression and anxiety that I'm thinking about depression from my point of view than you would have expected. From my point of view, I had a mild, sometime depression before my stroke, but after, I had gone through 2 antidepressants before finding one that was okay. So I was an antidepressant myself, and I've still had the same antidepressant 13 and a half years later with no more depression. So from my point of view, you gotta have anxiety or depression because it's basically everybody.
Would you think that it possibly goes undiagnosed? Do you think that people don't want to accept the possibility that they are depressed and possibly look at medication as a weakness?
Yes, I'm talking about from the beginning to a year and a half, as opposed to just at the beginning.
Yes.
If I would have said that in the first month, there would have been a smaller number of people who were depressed. But everybody, over a period of year and a half, has depression. So it varies, and some people are more likely to develop their depression after rather than when they're at.
Great, thank you for your comments. Mary Ann, how about you?
I think it's a matter of mourning. Mourning the way how you used to be, and mourning because you can't do stuff that you did before. My personal thing is I have limited use in my shoulder, even more limited use in my arm. I have no use in my hand, and I walk with a limp. And I find that depressing because I can't do physically what I used to do. I miss knitting. I miss being able to get a sliver out of my hand. Yeah, it's a lot of mourning until you can identify it and then come to terms with it. I'm sure that it's depression.
Thank you for being honest with your view. And Herb, how about you? Have you suffered from anxiety or depression? And if you have, what strategies have you found helpful?
Well, I've had to work on it a lot. I have had a counselor for organization, you know, speaking of declutter, because, you know, because the table full of letters and mail that I had gotten was so overwhelming. I just couldn't even stand to begin working on that thing. So I got, actually with an intern, and she came and helped me go through this stuff. And then I had a counselor who helped me with organizing, and I also had a counselor who helped me with self-esteem stuff, in that, you know, you're stuck inside. I mean, I was stuck inside a lot, and was not able to move around, to be as, I was tired a lot, you know, and so I would have, but I would also try to give myself credit for doing the best I could. You know, I mean, in that sense, we're all in the same place, we're all doing the best we can. Everybody is. Even the worst person in the world is doing the best they can. And it's awful hard to look at it that way sometimes, but we're doing the best we can, and to give ourselves credit for that we're trying to make our world be a better place, including our own energy in it. And so spiritually, it's very important to develop your own presence in that too.
Great, thank you for your thoughts. Well, there's all kinds of, sir, we haven't heard from you this morning.
Yeah, it's you guys who said, talking about depression. When after my strokes, and I came out of a coma, and I learned what happened, I was very depressed. And I realized after a while, I hated where I was, and the way I was gonna get out of it, I had to find a way to do it myself. And I realized that one of the things I have to do is be positive. Early on, that became a conflict, because how do you be positive to you, even to yourself, when it comes to doing something, you can't do it. Just say or think I can't do it, that in itself is negative.
Yes.
And if you do it enough, it sends the wrong message to your brain, and it just doesn't want to bother with it anymore. So I realized I got to say and think I can't do it yet. That would send the message to the brain, keep trying, maybe you can. And I found that helped me a lot, and since then I found that it's helped a lot of people.
Thank you, the
Yeah.
perseverance through that. We haven't heard from Marcia?
Well, I had a brain injury, oh my gosh, it's like 23 years ago. I was clinically depressed for the first 4 years. What I learned since then is there are several kinds of depression. One is actually a change in the chemicals in our brain. And as you know, a lot of the drugs that kind of help depression change the chemicals in our brain. So there's that, and then there's the normal, what I call depression, of that we've changed, and oh my gosh, what's life got for us, and you can have both. And then, so I was fortunate and got a lot of help, a real lot of help. But one of the keys that I still use is I laugh at stupid stuff all the time. And laughter actually has been proven, and smiling when you feel ridiculous. Just force yourself to smile right now. Go ahead. There you go. And see that? You're laughing. You can't help yourself. It changes the chemicals in your brain. The muscles. The muscles trigger some happy thing in your brain. So, you know, not making fun of yourself in terms of being mean, but, you know, laughing at the silly things and laughing at the dog or whatever, just to smile, like Ralph said, be positive.
Marcia is an invaluable resource with Brain Injury Network here in Maine. Please get her phone number. She's got a ton of information that could be helpful to you folks. Yeah. Anybody else? Let's see. We haven't heard from you this morning.
This is something really silly that I do, but I was assaulted. I worked in tech. I worked with special ed kids, and I was assaulted about a year ago, so I've suffered a brain injury. And I used to be very active, and now I can't, you know, I can just barely walk a squeak of what I used to. So when I do, if I go out for a small walk, and I try to reward myself. I put a smiley sticker on my calendar, and it's just something goofy. It's kind of like what you said, it makes me smile, makes me
Yes.
happy. I see these little smiley face things, kind of like the star on the forehead.
So,
you know?
rewards for small steps.
Rewards for small steps.
Excellent.
It's just like a visual, something makes you smile and, yep, makes
Thank-
you happy.
Thank you. Yes, sir.
I mean, after my stroke and in my 3 months here in rehab, I mean, I felt pretty disconnected from the rest of my world. And because I naturally gravitate toward technology, just reforming a community online through Facebook and a blog that I write was valuable to me, just to feel part of that community. I think it also helped others, friends and family, to hear from me and to put a voice to my experience
Mhm.
in a way that they can appreciate and relate to, and have this back and forth with them, even if it was a virtual community that was formed. That was really important
Thank
to
you.
me.
I'll give you a personal, just a quick little thing. When I was here at New England Rehab, I just couldn't get my head wrapped around the therapies that I was trying to receive. And with a very caring doctor, we diagnosed that I had severe depression. Duh. And it was the light that went off inside my head that sometimes people will look at depression as mental illness and as a negative thing. And I kind of had that in my own being, so that was a learning experience for me. And that I looked at medication as a weakness. Once I got over that and started, we found something that worked for me, that I was able to now take on these strategies. Like cleared up my head. It was wonderful. So medication is a tool that we can all use. Doesn't mean that we're on it for life. Sometimes it could be a short period. Sometimes we might have to. But I think it's how we look at that as it's just one more tool we have in our bag of tricks to be able to help with our brain injury. Yes, ma'am.
So, I'm Angela Mikishi, and I had a brain injury 4 years ago today, being a passenger in a severe car accident. And one major thing that
Can you speak up a little bit? Sorry.
Yes, of course. One major thing I think I really have to come to terms with is it's okay to grieve for yourself. Like, I was a type A personality, you know, we all look fine, we all look like there's something wrong, so why would I act like there's something wrong? Like, if no one knows, then no one should know. And I think that really beats you up inside. Like, you really have to, it happened, it's an actuality, and if you take the time to actually cry or be upset, and the people who really care are gonna understand, you're actually gonna come to more acceptance with that. Because if you keep trying to pretend like it didn't happen, because all of us wish that it didn't happen, every single one of us, but it happened. And so, if you actually take the time to grieve, I really think that is a major step in overcoming depression or anxiety.
Thank you for sharing that. Yes, sir.
I apologize for being late, but that's one of my problems.
We can appreciate that.
I usually put my huge ones, I forget, but anyway. Depression is hard for me to define. I think everybody that has brain injuries has to define depression in their own way. Mine is hard because when my accident affected me by taking my hands away, so my rehabilitation of my hands is depressing me. I've used my hands all my life. I'm a union bricklayer. I've been 40 years in the business, and I'm a professional bricklayer. It took my profession away, it took my hands away, and I can't wrap I'm not depressed. I'm learning how to help myself work with my hands to change the brain. It's just a quick mess that I'm in. But it's a fine line of depression for me. I don't want to call myself depressed. Because I'm not a depressed person. Or I am. I can't define it. I don't have a definition. I can't pick up the dictionary. Here's depression. Because I never used it my whole life. All of a sudden, every corner I turn, man, that is, I'm depressed now. I'm not depressed, I just can't do that. You gotta learn how to. So it's that type A personality, withdrawn. What is depression? How do you define depression? How do you live with depression? If this is what you gotta do, and depression is it. If this is that little monster that I gotta deal with,
Yes.
I gotta knock him off my shoulder every now and then, not be depressed, because you can't be depressed. That's where I'm at with depression. I'm like this, I'm at what's end about depression, and I don't know.
You know,
I don't want
those-
the chemical, I don't want to do that.
Yeah.
So I'm all over the map with that.
But those are all great questions.
Yeah.
So you're saying basically it doesn't matter what you call it, just you learn to deal with it, and if you
It's
don't wanna call it
retraining
depression,
my brain, that's
retrain
been
your
trained to
brain.
do for many years, and then come out with somebody else.
I
Yeah.
think Mindy and then
Yeah.
maybe Tom?
Yeah, Mindy?
Alright, I think that personally, for me, I'm just gonna say a quick thing on depression, but I'd like to focus more on the anxiety and panic part, just because I dealt with a lot of anxiety and panic attacks. But I think for me, I had so much going on for the first, year of my life. I didn't even realize that I was depressed, and the entire time I was depressed, and I'll sit here and tell you, I was depressed, and I know now. But I had so much other things going on in my life from the brain injury, I couldn't even think. I couldn't even begin to put myself in that direction, like, oh, you're depressed and you need to, you know, address this area of your life because, I mean, there's the lights, the noise, the memory, the fatigue, there's so many other issues that were just overpowering the depression that it took like a serious emotional, mental breakdown for me to realize, like, for the doctors to be like, you're seriously depressed and you really need to address that. So I think that maybe sometimes people don't even realize, because there's so many other issues that are on the forefront, that you don't even realize that there's a lot of depression going on the inside, and until it's there and it's built up and it's like, boom, okay, I'm depressed. But that's how I feel about depression. But I've been, you know, I take medicine for depression. There are some days that are worse than others, but I think a big piece, I know we really haven't talked much about anxiety and panic, but I dealt with anxiety and panic attacks like it was crazy, day after day after day after week after week after week, and it almost like controls you, because everything would give me anxiety, going out in public, listening to people talk. I couldn't handle any of that. And so a big piece that was helpful for me when I started therapy was the mindfulness group. They have a mindfulness group here at New England Rehab, and it just taught me to, if anything, take 10 minutes out of my day every single day and just have it me time, not anybody else time, not think about anything else that's bothering me, that's anything else that's going on with my family, nothing. Find an activity that I could do that I was just focusing on that activity, whether it was deep breathing, whether it was a meditation activity, whether it was going to sit out by the ocean and just paying attention to the noises of the ocean, to the birds, to the texture of the sand, and just putting my focus there instead of putting my focus on everything that is just comes with brain injuries, and just, you know, taking a step back from that and just letting your mind relax. And that honestly helped me to control my anxiety, to control my panic, and with that I started having less panic attacks, started having less anxiety attacks. And it's just, you know, taking 10 minutes out of your day just for yourself is very, very, very key, and keeping that in your routine every single day. You know, it's important, and it's very important to your mental health and everything like that. So, yeah.
Thank you, Mindy. We've got time for one last comment. Tom, did you have a thought?
Yeah, you've all given a reason to depression and anxiety. There's also a positive about what you're up against. I've always been a sailor from the time I was a little kid. And after the stroke, I couldn't do anything. As I told a couple of you, when I first was in the hospital, I was unconscious for a week, and when I came to, sort of, I was just a word or two, and sat in a wheelchair, the best that I could hold. But I was able to, as time went on, pick a number of things that were related to getting back to sailing that were spectacular. And it was awful to think about them, but it worked. Things like getting sure that that I could use a inflatable dinghy so I could get out to our boat, that I could get along with in North Haven, where we go in the summer. There's a 24-foot boat that we did before the stroke, and it's been modified by a lot, so that it can get away with me, in spite of the fact that I'm with my stroke. There are a lot of things like that, and if you're a bricklayer, but you want to do something still related to your situation, there's something you can do that might be where you want to go again, that will help again, the same way as I did with my sailing career. It's just, there's a lot of things that you have to just do what you think, that you have to just keep going until you've got the right, to make it easier for you. So anyway.
Learn different strategies to pull it off.
Well, it only dawned on me a couple months ago that the strategies everybody talks about were compensation strategies, that we have to compensate for and work around. And then it was like this light going off, like, oh, that's what I've been talking about for almost 5 years. Strategies are compensation strategies. It took a while for that to sort of sink in. We're almost out of time, but as you can see, we filled up 5 or 6 pages of this flip chart here. A lot of strategies that we can use to work around the deficits that we may have. With time, perseverance, and patience, which is not easy for some of us, these new skills can be learned, and they can help us to deal with the issues that we may face on a daily basis, maybe more than once a day. So I hope that this has helped you to think about how to better cope with these problems, and we do have a handout for you that Mark will make sure that you get. Most of them are yellow, but the machine was acting up, so some of them are white, so get your choice. Please remember to fill out your evaluation so that you get to turn your little raffle ticket in. Yes, and thank you.